Hi and welcome to the next video in our series, and this is covering caesarean birth or belly birth, whether elective, emergency, it's not often an emergency, and a gentle caesarean as well. So physiologically, this is major abdominal surgery, and I think a lot of us, especially if you've had a caesarean, have probably heard the saying "too posh to push," and I would say in most cases this is not an option that women take lightly. There are many reasons why it will have been elected, either a medical reason or it could be just a real phobia. Some people have a real innate phobia of giving birth, and there is so much fear that this fear is going to get in the way of them having a natural birth, because the oxytocin won't flow, because they will be full of cortisol, the stress hormone. So a caesarean is not the easy way out. I like to call it belly birth because you have birthed your baby, and for a lot of women it can be quite traumatic, and for a lot of women it can be a very positive and empowering birth experience, just the same as giving birth vaginally. So belly birth, C-section, caesarean birth, whatever you would like to call it, is what we're going to cover now. So what do they do? So this is going to happen in surgery. You will have the surgeon, an anaesthetist, your midwife, another midwife, and other people in the room, maybe up to 10 or 11 people in the room, and your birth partner, of course. Obviously things may be changing with COVID, but I'm pretty sure at the moment your birth partner is there with you, masked up, obviously with negative test. So it's major abdominal surgery. So you'll be laid on the bed, you'll be prepped for surgery, and the anaesthetist will give you a spinal block. So you will feel nothing pretty much from the waist down, or maybe a little bit lower. After that, they will make the incision through many layers of tissue. They most go horizontal across the top of the bikini line. Very occasionally they go down, depending on the nature of the caesarean. But we'll get into that afterwards. And the final cut is into the uterus, where the baby will be taken out. And that's why it's belly birth, because the baby is birthed from your belly. From here, they may be taken away for monitoring, or they may be put straight on your chest. And so this is where we get into the different options. So the first option, elective caesarean, is going to give you and the surgery team probably the longest time to discuss your wants, your needs, your desires for how you want that caesarean to go. So you can ask for what's called a gentle caesarean, and a gentle caesarean, you'll have maybe your music on, the lights might be dimmed, I've heard, but obviously not right on you. You can have the screen down and watch if you would like. The bed can be tilted up so you can see better if you would like. They can allow the baby to come out really slowly, where they walk the baby out. And obviously this is at the surgeon's bequest, really. So you can ask them. A lot of them are open to this. Obviously, if they're not, you know, they are in charge of the surgery after all. But you can put across what you would like, and they'll often meet you at least halfway, if not going all the way with you. Also, you can have delayed cord clamping. That's a whole other topic in itself I haven't covered yet, actually. So delayed cord clamping can be super beneficial for the baby, as when they've given birth, some of their blood is still going around in you and the placenta, and so leaving it a couple of minutes at least for the cord to become white means they get more of their blood, so they're given sort of more of a boost, if you like, before you cut the cord, and then they have to make more blood themselves. So delayed cord clamping. You can also ask that they not be taken right away. I mean, it depends. Again, with elective, then they know the baby is quite happy and healthy. It's much easier for them to just put the baby straight on your chest. They'll leave it free from monitors. If it's an emergency caesarean, and there may be some worry about the baby, and that's why they've elected to go for an emergency caesarean, the baby may need to be taken away for a few moments, but your birth partner can be ready, bare-chested, following baby, to go with them, be with them, and then have them on their chest as soon as possible whilst they bring them back to you. Yeah, and I think that's it really. So it's like straight on, skin to skin. After baby's out, you've got baby on your chest, maybe dribbling into your mouth, you're taking pictures with your partner. They're going to sew up all the incisions they've made. So there's quite a large wound, and this will take a little bit longer to heal than a straightforward vaginal delivery. It would like to know, if you've had something like an episiotomy, there's an awful lot of layers of tissues to heal as well. So in both these cases, you're going to have a longer recovery than what's called a normal vaginal birth, whatever that normal means. But in birth terms, normal means no tearing at all. Okay, so there's no tissue to recover. So you keep that in mind. And I would say the rehab that they offer you, I had a cesarean, was go for a walk. How far, how fast? They weren't quite sure, but I would know because it would hurt if I'd done too much. And so I've got a whole list of belly birth recovery tips. So it's something that you're interested in. If this is what happens, that's the path your birth takes, then send me an email and I will send you my top tips for belly birth recovery right back. So emergency cesarean. I had what was called on my birth notes an emergency cesarean, and I have to say it didn't feel very much like an emergency. In the end, I wasn't progressing, not much was happening, and I was given a few choices. I was given the option to go on the drip, and I was given the option of cesarean. And for me, the cesarean option was the one that was clearly going to be the best for me and my partner and my baby. So then they said, right, we've got a real emergency cesarean going on right now. So probably in about an hour, unless another emergency comes in, then we will do you. Otherwise, you'll wait and you'll be the next one after, because it wasn't sort of like a emergency. It was like, well, we need to get the baby out soon, but you have time. So they prepped me, they got me all ready, and when the other lady and her baby had come out of surgery, then I went on in. I think, out of memory, it took maybe less than an hour. So from cut to baby, as they say, it took 15 minutes. So it took 15 minutes from the first cut to baby being on my chest. Pretty quick. They can do cut to baby in less than that. I wish I remembered, I hadn't planned to put this in, but it was like 3 minutes, if not less. So then you can see the recovery from elective and not so emergency to a real emergency cesarean. So what is that? So if you have the cord, if the cord comes out and gets stuck between your vagina wall and the baby's head, then this is an emergency, okay? That's the baby's air supply has stopped, the blood supply has stopped. So that is, you know, a quick, we need to get that baby out right now. The midwife will push the baby up to take the pressure off and you'll be rushed into surgery, okay? So that's going to be a real emergency, super quick, baby's coming out, okay? And that will be a general anesthetic. So the difference between elective, the kind of emergency, and then a real emergency cesarean is often the anesthesia. So a real emergency cesarean where they need to get the baby out as quickly as possible, you're going to have a mask over your nose, general anesthetic, so it's longer to recover, and obviously you're not going to be able to watch the birth. But if that is medically necessary for the health of you and your baby, then it's definitely well worth it. Recovery time may be more because they don't have such a long time to carefully cut the tissue, so there may be more scar tissue on recovery. So is there anything else I wanted to cover with cesarean? I don't think so. I would look at it as belly birth, another path that birth can take. It doesn't mean you're less of a mother if you have a belly birth. It doesn't mean that your recovery is going to be easier or harder than someone who has a vaginal birth, and it may or may not mean you have more birth trauma than someone with what seems like a normal birth. So it's another way that birth can go, and so if you know all your options and all the different ways a cesarean can look, then you will be empowered to make the choices that suit you and your baby. Please fire away with any questions that you may have about belly births.